Hello, I am Dr. Anand Mamdani from the Department of Neurology. This is the third module in the series of altered mental status. It focuses on various etiology of coma. This module has two objectives. After finishing it, you should be able to identify different causes of coma or altered mental status and discover possible etiologies of coma based on history and physical examination. There are many causes of coma or altered mental status, but we will be focusing on some of the more important causes of coma. Firstly, vascular causes like ischemic stroke, especially because of bilateral internal carotid artery occlusion or anterior cerebral artery occlusion or basilar artery occlusion, intracerebral hemorrhage, subarachnoid hemorrhage, hypoxic or ischemic insult to the brain. Next are infectious causes, either because of the primary CNS infection like meningitis or encephalitis or brain abscess, or systemic infections causing sepsis, subacute bacterial endocarditis. Next is trauma causing traumatic brain injury, epidural hematoma, subdural hematoma, cerebral contusions, intraventricular hemorrhage. Next is tumor, either primary CNS or metastasis from the cancer of other organs. Next are metabolic causes, which is the most common cause of coma, caused by electrolyte abnormalities like hyponatremia, hypercalcemia, hypocalcemia, uremic or hepatic encephalopathy, hyperglycemia causing hyperglycemic hyperosmolar state or diabetic ketoacidosis or hypoglycemia, various endocrinopathies like myxedema coma or thyrotoxicosis or Addisonian crisis. Next is ingestion or toxic etiologies due to ingestion of alcohol, narcotics like opioids, sedatives like barbiturates or benzodiazepines, or drug overdose. It can also be caused by exposure to carbon monoxide, lead, methanol, or ethylene glycol. Continuous seizures or post-ictal state can also cause coma. It is very important to have a detailed history in a patient with altered mental status or coma, but ironically, it is really hard to get proper history from a patient who is in coma or has an altered mental status. So most of the times, the history will be collected from witnesses or bystanders, family members, friends, paramedics, or medical alert bracelet to determine the etiology of altered mental status or coma. If patient has an abrupt onset of coma, it can be because of stroke, seizures, subarachnoid hemorrhage, traumatic brain injury, or cardiac arrest. If patient has a gradual onset, then brain tumor, subdural hematoma, infection, or metabolic causes would be at the top of differential. It is also very important to know any symptoms prior to the coma, like a patient has a transient neurological symptoms like facial droop, balance issues, hemiparesis, sensory changes before coma can point towards stroke, whereas history of trauma like fall or motor vehicle accident points towards traumatic brain injury. Recent fever points towards infection. If person has a history of psychiatric disease and was found near the empty pill bottles, can point towards suicidal overdose. Kids in the house can reach to the pill bottles and can have an accidental drug overdose. Past medical history is also very important to determine the etiology of coma, like a patient who has a history of diabetes and is non-compliant can have diabetic ketoacidosis or hyperglycemic hyperosmolar state, or if patient with diabetes took excess of medication and didn't eat can have hypoglycemia as a cause of coma. Patient with hypothyroidism and non-compliance can develop myxedema coma, or patient with thyroid disease can have thyrotoxicosis. History of hypertension and non-compliance point towards hypertensive encephalopathy. If patient has a history of bleeding disorder, then patient can have intracerebral hemorrhage or bleeding as an etiology of coma. Cancer, most likely lung, colon, breast, can metastasize to the brain and cause coma. So history of cancer is also important. History of renal diseases can cause uremia, hyponatremia, hypocalcemia or hypercalcemia as an etiology of coma. At last, reviewing all medications that patient is on helps with determining the etiology of coma. Physical examination also plays an important role in determining the cause of coma. Vital signs like hypertension point towards hypertensive encephalopathy. Hypotension can be caused by hypovolemia or sepsis or cardiac failure. Tachycardia could be because of hypovolemia or sepsis. Bradycardia can occur with beta blocker or calcium channel blocker overdose. Fever can occur with infection, heat stroke, anticholinergic or salicylate toxicity, or thyrotoxicosis. Decreased respiration can be because of toxic or metabolic causes or drug overdose like opioids or benzodiazepines. Increased respiration can be caused by acidosis, hyperthermia, or sepsis. Lastly, hypertension, bradycardia, and irregular breathing, which is also known as Cushing's triad, points towards increased intracranial pressure. During general examination, cherry red lips is caused by carbon monoxide poisoning. Patient with convulsive seizures may have bitten tongue. A person with needle trachs points towards IV drug use. Patient has jaundice, spider angiomata, and hepatosplenomegaly point towards liver disease. Goiter point towards myxedema coma or toxic thyrotoxicosis. During eye exam, if you find subhyaloid hemorrhage, then it's because of subarachnoid hemorrhage. Exudates point towards hypertensive encephalopathy. Papillary edema suggests increased intracranial pressure. In summary, there are many abnormalities or diseases that can cause coma. Most common causes are metabolic, toxic, infectious, or structural. Getting a proper history and doing thorough physical examination can help to diagnose the etiology of coma and treat it accordingly. Additionally, I recommend these resources: Neurology in Clinical Practice, Chapter 5, Stupor and Coma, available as ebook at Roland Medical Library, as well as Disorder of Consciousness, Clinical Practice, available at Osmosis.